My name's Valadie. I'm an orthopedic surgeon here with Coastal Orthopedics and Sports Medicine. I've actually been here since 1996. I grew up in Tampa, and so close by. And then when I finished high school, obviously went to college, and I'm a product of state schools. Went to Florida State University for undergraduate, and then switched over to University of Florida. And med school is a time where you get exposed to all aspects of medicine. I wasn't really 100% sure exactly what I wanted to go into in terms of surgery or medicine or pediatrics, who knew? But we got exposed to everything, and it became pretty clear pretty early that I really liked orthopedics. When I was finishing my training, I looked all over the Southeast, tried to figure out where I wanted to live. And I had some offers up in North Carolina where I trained, but whenever I came back to Florida, it just felt like home. So I love it down here. So I really looked up and down the west coast of Florida and found what I thought was a great opportunity and a great community here in Bradenton. Well, orthopedics has progressed over the years, and it's changed over the years. Certainly, I think we get better at what we do. We also become more and more subspecialized, like a lot of fields are. You know, used to be an orthopedic surgeon just kind of took care of everything related to bones and joints, and we really subspecialize more into sports medicine, joint replacement, which is what I tend to do, spine surgery, foot and ankle. One of the commitments I made almost internally when I got here was to bring the quality of orthopedics in our community as high as it could be. I didn't see why there was any reason that we couldn't provide as good a quality as some of the bigger communities in Florida, or honestly any of the places around the country, the Mayos and the Cleveland Clinics. There's no reason we can't do that. So that's always been my goal, is to say, let's provide the best quality that is available anywhere in the country right here. So that was my own personal commitment at the time, and us making commitment to set up a new facility that's going to be state-of-the-art, just as part of that ongoing commitment to provide the best that we can provide to this community. It sounds a little corny, but honestly, my favorite part of my work is still connecting with patients. I just love the one-on-one relationships that we get to develop. I had a patient come in, a Hungarian lady, very nice lady, and she had her hip taken out 10 years prior to that for an infection, and they had told her that she would never have a hip again, and she came to me and evaluated her, and ultimately was able to get a hip replacement actually back in her and restore her quality of life. And I've had some patients who have had two bad hips to the point where they were in a wheelchair, and we actually replaced them both at the same time on the same day. And it's remarkable to see these people up and walking literally within a matter of a couple of days. Honestly, just being able to do this for over 20 years and on a daily basis, restoring patients' quality of lives and bringing them back to a position where they can do what they want to do and love to do, that's a highlight in and of itself.